The whole concept of an academic centre has really developed over about 20 years.
We were sort of like just looking at how we can actually expand and do some more education.
A number of us over the next sort of 10 years became fairly active, working with the School of Public Health at Monash University.
And now it's so much bigger, and it's really just something that we all are extremely proud of.
I actually arrived at Alfred Health 10 years ago. What I found when I arrived was this unbelievable group of people who were doing incredible work in academics. The course that was existing before I arrived was the Emergency Medicine Research course, had been going for years and is a core part of ASIM training. So it's really the backbone of our program, and we grew from there.
A series of us started the Emergency Medicine Research course. I'd like to claim it was one of the first courses, and that's 10 years ago. And then 2012, we had probably one of the first conferences that's come out of Alfred Emergency, and that was the Global Emergency Care Conference.
Most of them are doing it in their spare time because of their passion.
My role is to enable and support and guide the work that the centre does across all of the streams of activity. So we've got our research, we've got our education programs, our work in global programs overseas, and we've got our new arm of innovation looking for exciting ways to change the way we deliver emergency care.
And the only way you can deliver excellent care is by challenging what you do every day. Challenging the orthodoxies, striving for excellence. It sounds a bit of a sort of, throwaway line, but actually, if people have that culture, it makes a difference. And no matter what survey you do, if the culture is to strive for excellence, they do better. Virtually everything that I learnt as an intern has been proven to be wrong. Obviously being nice to patients and stuff is still good, but in terms of, if you like, the orthodoxies, you must do this, you must do that, very little of that has withstood rigorous scrutiny.
Part of the centre is to have research and education linked in, so therefore research informs the improvement in patient care. It's this combination of combining the academics of emergency medicine with clinical care that's very needed.
I would love to see the academic centre to be at the centre of our clinical workspace as well. All research will be coordinated, all education, all innovation, all project management. We believe that the academic centre has been playing and will play an incredibly important part going forward.
Not only will it provide leadership opportunities, development and growth opportunities, coaching, preceptorship and career trajectory advice, this centre is going to be pivotal in allowing emergency nurses to feel so confident. I want to see in 10 years the names of many nurses on the forefront of emergency medicine research.
I think the opportunities are endless, and that seems like a very generic response. But seeing what the clinicians are able to do in the clinical setting, when you give them the space, when you give them the environment, when you give them the permission to really think about what does the future of healthcare look like, I'm really excited about what that will bring.
I see one of our key priorities for the centre is providing opportunity for our staff. Not just teaching opportunities, but opportunities to participate in research, to drive innovative ideas, or to perhaps go overseas and work in other areas. There is a huge benefit to that, and we hope, and it's one of my priorities, that by establishing the centre and really expanding and formalising what academic programs was doing previously, that those opportunities will only grow.
The stream for innovation will also allow us to look at new and exciting ways that we can improve the care that we deliver to patients in the emergency department. There's a lot of opportunities when you come to the academic centre to meet different people from different streams doing different interesting work. It's also an opportunity for us to learn from you and hear about the interesting work that's happening in your part of the world, and I'm hoping that that will really build a community and a culture of engagement with team-based emergency care education.
There's a t-shirt that you get when you do the Carmen run. Looking at this t-shirt, because lots of people are overtaking you, you're looking at the back of the t-shirt and it says "Let's run together." It's really about what we're doing, because everyone's running in the same direction but we can achieve so much more if we're running together.
We're here to serve not only the department but also our community, and we're happy to have a conversation about what we can do and where we can assist them.